It's good morning, good afternoon, and good evening, wherever you are streaming from. Welcome to the Real Talk Show. My name is George Mukwita. This is the show that brings you a very important conversation around your health and your health matters. Wherever you are across the region, welcome. And this is yet another exciting show. Today, we are talking about the importance of HIV prevention among us young people, and we'll be looking closely at the powerful tools we call PrEP and PEP, how they work, and do they really work in HIV prevention? You'll find out all that right here on the show, as we do have experts that are here to break it down to ensure that you understand how and when to use PrEP and PEP. So joining me today in the studios, very exciting individuals in their own rights and experts, as I mentioned. So, by the way, this episode is brought to you by the Youth Response Challenge, the community response to HIV prevention implemented by the YLab project, and ensuring that young people have access to services across all facilities that we are working with. It also supported by CEDA as well as Action Aid Zambia. So let's get into it. To begin with, I'd like to ask each of our guests to briefly give us to introduce themselves and their role at their respective organizations and health facilities. So we'll start with the gentleman. I know it's always ladies first. So let's go with the gentleman today.
Right, thank you so much. My name is Ziambo Josephat, and I'm based at Kapata Clinic, the focal point of the facility for quick person, as well as the clinical surgeon. Thank you.
Okay, who would like to go next? Thank you so much, Ziambo, for that one.
Okay.
You can go.
Okay, how is everyone doing? This is Monida Muya, coming from Choma General Hospital. I'm a registered nurse in the National Training and Adolescent Health, also a focal point person in adolescent health at Choma General Hospital. Thank you.
Thank you, Monida, and you're welcome to the show. Victoria, I'd like you to be the last person to introduce yourself, since you are almost a resident here. So we'll move on to...
Hello, everyone. Good morning. My names are Ren Mlala. I'm an HIV prevention stroke sexual reproductive health advocate. I have a full-time role in programs. I'm the programs manager at Latkins Outreach Program. Yes, so I'm pleased to be here and be part of this discussion.
Okay, that's great. Finally, last but not the least, yours truly, Victoria. Please go ahead.
Thank you so much, George. My name is Natasha Victoria Nakanyika. I work for the Youth Platform as a project officer for the Youth-Led Advocacy Project, and also a sexual reproductive health advocate. Thank you for having me.
Ladies and gentlemen, thank you so much for making time to be on today's show. And all those that are just tuning in right now, thank you for streaming with us. Today's topic is, does PrEP and PEP really work? We're here to really find out if it doesn't, if it does at all, how does that work? So our guest once more is Reni Ziambo, as well as Monida, not forgetting Natasha, who's project officer for the YLab project. So let's jump into it. I want to start with you, Ziambo. Let's start with PrEP. For our listeners who are joining us in Chipata, across Zambia and the Southern African region, can you explain to us in simple terms what the term PrEP means or is, and how it works in the prevention of HIV?
All right, thank you so much, Mr. George. And thank you also for TYP for giving me this opportunity to be on this platform. So I'll just go direct into the session. So we're talking about PrEP. PrEP, I would say it's. I'll start by defining the meaning of PrEP itself. So PrEP is pre-exposure prophylaxis. So in this in this context, we're talking about HIV. So these are medications that are given before you are even exposed in getting HIV, so that you are prevented. How does it work? So PrEP, I would say it's more like a vaccine. Those medications that are given, of course, they are ARVs. What they do is they just make our immunity strong, so that as you get exposed to HIV infection, instead of you getting that infection, it will be suppressed. In good terms, that's how I can explain about PrEP and how it works, Mr. George.
All right, thank you so much. I know the conversations usually revolves around the effectiveness and how effective is PrEP in HIV prevention when taken as prescribed, especially for young people. My question is, for those considering it, how do they go about it?
Thank you so much. So talking about the effectiveness of this medication, rather of this PrEP, it's effective. I'll just give an example. I think of all people that have come at our facility in terms of accessing PrEP, those that have been on PrEP, I think it's effective in the sense that after them going through that, the I would say the whole process of being on PrEP, even after they're exposed, because at the end you need to do some tests so that you confirm if at all this patient, or rather this young man, was protected. So I would say it's 100% effective, because no one has ever come tested positive after being on that regime of PrEP.
Okay, are there any specific situations or risk factors that would make a young person a good candidate for PEP? And what kind of conversations would you have with them to determine the eligibility? Who is eligible for PrEP, in short?
Okay.
And what factors contribute to that?
Yeah, thank you so much. So the people who are eligible for them to take PrEP, we consider, especially young people, those that usually come with, those that come at a facility who are exposed, especially to STIs, because when you see young people having STIs, you know to say they are not using condoms, they are not having protective for sex. So those ones are eligible. We're talking of sex workers, because those people are, I would say, they are exposed to sex, or rather to partners who they don't know their status. So talking about also partners, or rather couples per se, discordant couples, where you find one is HIV positive and the other person is HIV negative. So those people are eligible to start PrEP. When you talk about risk factors, there are no really risk factors that can keep someone not to take PrEP, because it is almost of all age, as long as you are exposed. Yes.
Beyond the medication, maybe Ziambo, let me ask this. What other support or services do young people on PrEP receive, specifically at Kapata Clinic, to ensure that they stay healthy and protected?
Okay, so if someone has been put on PrEP, the support that we usually give them, or rather what we provide to them, is first the information. Give them information about PrEP. Then also we tell them to come at our facility regularly in check of STIs.
Okay.
In check of
All
STIs,
right.
yes.
Okay, thank you so much. If you just joined us, thank you once more for streaming with us. Remember, this episode is brought to you with the compliments of the Youth Response Challenge, the community response to HIV prevention, being implemented by TYP under the Youth-Led Advocacy Project, supported by CEDA through Action Aid Zambia. We just heard from Ziambo, who's just broken down what PrEP is and who's eligible to take PrEP, when is PrEP taken, and the like. So I know that our topic today is PEP and PrEP. Does PrEP and PEP really work in HIV prevention? That's what we're here to discuss. So I'd like to move on to you, Monida. Let's turn our attention to PEP. To our audience, particularly young people who are streaming with us right now, what is PEP and how does PEP differ from PrEP in terms of when and how it's used in HIV prevention?
Okay, thank you so much, George, for that question. It's always exciting to be part of this show and share the knowledge and the experience with the audience and the young ones. So we are talking about PrEP and PEP. The difference between PrEP and PEP is PrEP is taken before exposure, while PEP is taken after exposure. So when it comes to PEP, this one happens when someone has exposed themselves. There are so many ways in which one can expose themselves, like for young ones. One of them is maybe rape. Maybe someone is raped and then that person doesn't know the status of that other one. Immediately when they come at the facility, you give them PEP because you want them not to get the disease, the virus, I mean. And then when it comes to PrEP, this is taken before one is exposed, and mainly they come to the facility like Ziambo said, you talk to them, those who are sexually active, those who are in discordant couples, you talk to them and then you give them the medication. Thank you.
Thank you, Monida, for that one. Now, PEP has a critical time window for effectiveness. Can you emphasize why it is so important to start PrEP as soon as possible after a potential exposure? And what are some of the consequences, or what consequences might be there if you delay?
Okay, so PEP works within 72 hours after exposure. That's 3 days. But we usually encourage anyone who has been exposed to come as soon as possible so that the drug has its good potency, as in how it's going to work. So when someone is exposed, they shouldn't relax to say this drug takes within 72 hours for it to stop working or to start working. We encourage anyone who has been exposed, they know that they have maybe met someone, they've slept with someone, they don't even know their status, or maybe they know that they've exposed themselves with other things that might make them contract the virus. We encourage them to visit the facility as soon as possible so that medication is given to them on time.
Now, Monida, what is involved in the process of getting PrEP? For example, at Choma General, where you work, from the initial point a young person walks in to the time that they actually do receive that medication. Could you walk us through the whole process if it's possible?
Okay, so at Choma General Hospital, or maybe one is exposed, they report to you to say, I've been exposed, maybe I did this. Exposure cannot only come maybe through sexual contact, maybe someone has a needle prick, they'll come to you, they report to the in charge, the one who is in charge of that ward or the facility where they are working from. They tell them to say, I've been exposed. From there, that person, the one who is in charge, will get that adolescent, they will involve the counselors who will counsel that adolescent. They explain to them the whole process of PEP. From there, they are tested because you need to be tested negative for you to start PEP. So when they test negative for PEP, the counseling session will continue. Then they'll from there, they'll issue them the drugs, and those drugs they have to take them within 28 days. So the process is it's not complicated like maybe when someone is exposed. Mainly when you're exposed, everything can even be done within an hour and you even receive your medication. And if you want to start, they'll even advise you the time that you're comfortable in. Is it in the morning or is it at night? So that you don't miss any dose. So from the counseling session to the dispensation of the drug, everything is done smoothly. There are no obstacles. The drugs are already available so that no one ends up contracting or getting the virus.
Now, before we turn to Rennie, maybe one quick question as a follow-up to what you just told us. Why is it important for, why does the process involve being tested for HIV? And for a young person who would like to access PrEP and then they do not really want to get tested for HIV, how do you handle such a situation?
Like we all know, you can't tell by looking. Like it's very impossible for you to know someone. Like at this time and age where we are moving at, there are people who are positive but you cannot tell. Maybe a long time ago, people would say, no, the hair is falling off and everything. But this time, with the availability of drugs, people are able to take their drugs correctly. And sometimes you might not even trace if someone is taking their drugs correctly, and maybe you test them, they test negative, meaning the viral load has been suppressed. So you need to get, as you are counseling them, as a good counselor, you need to make that person comfortable so that they open up and tell you. Because sometimes someone might even be on drugs. I mean, can be taking the ARVs and they test negative without your knowledge. So a good counselor has to do a good job whereby someone might should freely open up to say, oh, I'm on medication. So the guideline for PEP is you're supposed to give someone the drugs if they test negative. Because if they test positive, meaning the same PEP drugs are the same ones that people are reactive take. So it's a must that it's not really a forcing matter. No wonder they have to go counseling so that they're able and willingly accept to be tested.
Oh, yeah. Okay, thank you, Manida. It's always great to have you on this show. Now, I'd like to move on to you, Rennie. Welcome to the show, and good morning, good afternoon, and good evening to you.
Hello.
Now, Rennie, yes, Rennie, the Kings Outreach Program has a history of working with communities, particularly AYP, adolescents and young people, on SRHR. From your experience on the ground, what are some of the most common misconceptions or fears young people in the community have around PEP and PrEP, and how does your organization address these misconceptions?
All right, thank you so much. There are a lot of myths and misconceptions that are existing about HIV prevention, especially among adolescents. Firstly, we had a youth sensitization activity last year where we brought different adolescents from 3 health facilities from Chipata, Chazanga, and Matero. And the purpose was to be able to just get the perspectives of young people about HIV prevention. And that was a period when the newly introduced cabotegravir came. And then there were key things that came out of the young people. Firstly, young people, especially when it came to injectable cabotegravir, they felt it caused cancer. They felt that if you take injectable cabotegravir, it can lead to cancer. And some were saying that when somebody's taking HIV prevention, they already have HIV. And also, if somebody is taking HIV prevention, they are very promiscuous. So those were the 3 key things that were common among that focus group discussion that we had with those adolescents. So now, what are we doing? The question on what are we doing? Firstly, we conduct information sessions through partnerships with organizations like Ascent Futures Foundations. This is where we bring adolescents together and just educate them about HIV prevention. And not just educating them about the basics, the science behind it, and also, most importantly, how to use it, the side effects, that very key information, because we believe that young people are also very key to dissemination of information because they are found in different places. And also we like to utilize different spaces like youth hubs, online platforms, and also adolescent friendly spaces through partner health facilities to make sure that young people have adequate information and are knowledgeable about HIV prevention, so that we're able to promote uptake of HIV prevention. I hope I've answered your question.
No, you have actually. You have actually. Probably my follow-up question is that your organization is known for the mobile health service provision and school outreaches. How do these direct engagement method help in demystifying PrEP and PEP? And what kind of feedback do you receive from the young people accessing these services, if there's any feedback at all?
Okay, so firstly, when we have these community-led engagement or mobile-led engagement, we have a one-on-one with adolescents, and you will discover that young people are very, very curious and they are hearing a lot of things. So that one-on-one gives us an opportunity or a platform to really answer all the questions that these young people have, but also it's a best platform for referral pathways, because young people not only are able to acquire or receive information that they need about HIV prevention, but also if they need services, if they need maybe let's say psychosocial counseling, they need to access certain services, it is easy for us to make referrals because we have one-on-one. And also it's a great opportunity for follow-up, because what we try to create is an opportunity where young people who access services, HIV prevention services, we put them in a support system or in a hub. That helps with following up in terms of experience, quality of services, but also it's a good platform because a lot of young people fall in and out of treatment, and also it's difficult for them to adhere to services, especially right now we have different HIV prevention methods that are coming daily, and there's a temptation to jump from one method to another. So when you create a support group or a support system where young people are able to just check on each other and also be on track in terms of when and how they should be using these services, I think I might have lost your last question. Kindly repeat it.
It was about the feedback, for example, that you get as you.
Yes. So the feedback is also both on the negative and the positive. Firstly, on the positive, we're seeing young people really utilizing services because deliberately what we're trying to do is, young people cannot utilize services that they do not know about. The reason why young people uptake condoms is because we've created platforms or there's so much information about condoms. So what we're trying to do is we're trying to create HIV prevention, whether it is injectable, whether it is oral, so common to them that it's easy for them to access the services. So now the good part is that young people are really utilizing the services, but then the feedback also, the negative side of the feedback is the quality of the service. So like I told you in the beginning, in terms of misconception, the one key thing is the stigma that is related to HIV prevention. Whenever young people go to health facilities to access services, it comes up with promiscuity. This person is promiscuous. Why are they accessing such services? Why as a young person, why are you coming to the health facility to access HIV prevention, injectable HIV prevention? What are you doing? So they feel they find it difficult to go and access services, or they feel that they are looked at out in some way. And also the feedback is they would want to access HIV prevention in a much youth-friendly provision, where other young people who are there can actually help them access the service, where they don't feel uncomfortable. So those are the very key things. but also feedback is on young people are still uncertain because new products are coming every day. And also when a product comes, the key myth that is there is that this product works better than the other product. So let's say, for example, right now we have lenacapavir that has come, right? And we had cabotegravir. So we are going to do so much marketing about lenacapavir that young people are going to be conditioning their mind to think that lenacapavir is better than cabotegravir. So right now there's cabotegravir, and young people feel that cabotegravir is better than oral HIV prevention. So we really have to do our due diligence to make sure that we do not demarket other products while trying to bring different products or new products on board.
Now, Rennie, I have to stop you there because I would like you to break down the two terms that you were just bringing out. You are too technical for my audience. Could you tell us? What those two terms are and how do they work? Those two options for PrEP and PEP.
Okay, so apologies, sorry. We have, I think our colleague earlier, Ziambo, mentioned about HIV prevention. He did his due diligence to explain how it works. So what I'm talking about, what Ziambo was talking about was oral HIV prevention, right? This is HIV prevention that you're going to be taking, the tablets that you're going to be taking daily to prevent yourself from acquiring HIV. And like he mentioned, that they work like a vaccine. So now what I'm talking about is injectable HIV prevention. So injectable HIV prevention is where you get an injection, and this injection they're going to be giving you that injection twice every month. Sorry, like once every 2 months. That is for cabotegravir. Every 2 months we'll be giving you once.
This is the one that is new on the market, isn't it?
Yes, that one is the one that was introduced last year. So, and they are there at health facilities here in Zambia. We have at UTH, Chibombo Urban Health Center. I stand to be corrected, Chingola, and some other provinces. So once you take this HIV prevention method, you won't have to take it every day. When they give you the injection, you have to go back to the health facility after 2 months. And it's of course convenient because you don't have that pill fatigue. You don't have to take it every day, and it reduces the inadherence, because people have a hard time adhering to oral HIV prevention. Now, this year we are introduced to lenacapavir. So lenacapavir is also injectable HIV prevention, but this one is, the beauty about it is that you take it once every 6 months. So you only take 2 days in a year. So that one hasn't yet been rolled out like in Zambia yet. It's still at an international level. But my debate, really, what I was talking about is that the influx of this new HIV prevention method also is causing demarketization. What I mean is that when new products come, we market them so well that young people feel like the other product is better than the other. No. Absolutely. What is there is that we are trying to create a platform where we've got different varieties, different choices that are available, so that one picks what works for them. So even in our awareness and sensitization, we need to be careful with how we sensitize and disseminate this information to young people. That was what I was really talking about. I hope that
you could have simply said it like that rather than being all technical on us. Eh?
I am so sorry.
But we do appreciate the clarification. And if you're just joining us, welcome to the Real Talk Show. The topic of discussion today is, does PrEP and PEP really work in HIV prevention? And if it does, how? This is what we're talking about. So if you have any questions, please send through your comments in the comment section. We'll be able to respond to your questions. We have our guest today, Reni Mulala, Ziambo, as well as Monida. Now, I would like to move to our project officer, the youth-led advocacy project officer, Natasha, to just give us a little bit of insight on what the project is about. By the way, this episode is brought to you with compliments of the Youth Response Challenge, the community response to HIV and prevention, being implemented by TYP under the youth-led advocacy project supported by SIDA through Action Aid Zambia. So, Natasha, Victoria, Nakanyika, welcome to the show. How are you today?
Thank you. Thank you, George. I'm okay. How are you?
I'm great. Thank you. Thank you for joining us. Could you please give us an overview of the YLAB project and what are its core objectives? What specific activities are you currently undertaking to contribute to HIV prevention, specifically among adolescents and young people?
All right, George. Thank you so much for that question, and thank you so much for having me today. It's a rare privilege to be seated with, the experts themselves. I've enjoyed how they're breaking down all those big words and stuff like that. But then just to get into what YLAP is, YLAP is the Youth-Led Advocacy Project that is, like you've mentioned, supported by SIDA through Action Aid. And the project itself is grounded in the belief that young people should be at the forefront of the HIV response. So our core objectives are to increase the access to HIV prevention services, particularly PrEP and PEP, for adolescents and young people, as well as to just strengthen and amplify the voices and technical capacity of the adolescents and young people in their communities so that they can be meaningfully engage in policies and programs that affect their health and rights. So our focus areas are around youth-led advocacy, where through the community-led monitoring that we're doing on the project, we're collecting data that in turn leads to us coming up with advocacy or strategies that can influence some policies at national level, district, national level, as well as community mobilization. And we're also strengthening linkages between health facilities and the young people. So this project is in 2 districts. So one is in Eastern Province, Chipata, and the other one is in Southern Province, Kazungula to be specific. So since our topic today is around PrEP, I'll just speak to interventions that we're doing around PrEP and PEP. So currently we're running weekend clinics, which are normally called outreaches, but we call them weekend clinics in partnership with Ministry of Health through local health facilities that provide youth-friendly services outside traditional working hours. So there are some facilities that work, due to the structure of the facility, they work morning to 17 and stuff like that. They don't work over the weekends and stuff like that. So our weekend clinics ensures that we have services available for adolescents and young people that want to access during weekends, looking at most of the times during the weekday they're in school and stuff like that. So these clinics do not only offer PrEP and PEP, but also HIV testing, STI screening, and access to family planning. Like Monida mentioned about, you cannot give someone PrEP without testing for HIV. So HIV is a key component because it allows us to know if this person is negative, they can be put on PrEP, but if they're positive, they can be initiated on ART treatment. So aside from that, we also conduct school and community sessions to raise awareness and create demand for the services that we are providing. Yeah, so that's
No, thank you so much for that information. You spoke of weekend clinics and young people, accessing services during your weekend clinics. My question to you is, I know YLAP is big part of YLAP, as you mentioned, is about accessing young people accessing PrEP and PEP, particularly through these weekend clinics. Now, my question to you is: are young people accessing PrEP and PEP through the weekend clinics that you've mentioned? And what trends have you seen? Are they accepting it? Is there a stigma around it?
Yeah, thank you for that question, George. Yes, we're seeing a steady increase in the number of adolescents and young people accessing PEP and PrEP through our weekend clinics. Um, many of them prefer coming during like the weekend clinics to just speak to the facility staff that we have. So the facility staff that we have are usually those people that are adolescent friendly trained. So like Ziambo is the focal point person. He knows how to handle adolescents and young people, as well as Monida herself. So those are the people that we're using. The the trend that it was really hard for like you see the catchment areas that we're working with, like for Kazungura for example, I'll give that as an example. We're
Okay.
working with not only those facilities that are within town or within the border area, we're even working with facilities that are away from the border area, meaning that they are like really deep rooted rural. So one of the things like I wanted to say Ida. Rennie was just telling us here was that demarketing the products like other products. So the trend that was there was, why should I take PrEP? I'm not HIV. So like they had this myth that PrEP is ARV drugs. So why is it that someone that is not HIV positive should be taking ARVs every day? And then so just trying to see how best we can explain to the people to say it is one of the means that can protect you, because right now, because they knew about the Kabele, the injectable PrEP. So they've heard about it. So they're saying, why is it that us here we're not having injectable PrEP, we're having pills and stuff like that? Why am I going to be taking pills every day like I'm HIV positive? So those are some of the things that we're seeing. But then after just engaging, having those dialogues, trying to just demystify the whole HIV PrEP thing. We've seen that young people have started accessing PrEP. Yeah. Yeah. So
So, Natasha, maybe before I let you go, what impact has your project seen on the ground in terms of HIV prevention? If you have any success stories, I know you shared something just now. If you have any success stories, you can tell us. It doesn't have to be a very, very long one. Is the project making an impact when it comes to HIV prevention?
yeah, we've seen the impact has been like both measurable and deeply personal. So we've seen an increase in the number of adolescents initiating and adhering to PrEP. So we have community champions that are trained that will um, I don't know which word to use, that are going to go in these communities and just give or share information, have awareness sessions and stuff like that. And then if somebody is willing to have or be initiated on PrEP, they are then taken to someone who's a health staff among the 10 facilities that we're working with. Then they can be initiated from there, as well as more young people seeking HIV testing and returning for repeat services. Um, our weekend clinics have saved over like 400 young people in the past few months alone that are just
Wow.
coming to test for HIV.
Wow.
And most of the services, or the weekend clinics, the numbers we're seeing like more than 65% are the young people that are coming to access services when we look at the numbers and the records. So yeah, as well as how parents are just coming forth it's very encouraging, especially like in the rural parts of the country where they are feeling the impact of their young people who are
Okay.
becoming HIV positive. They are that it's not just health, it's also mental. They will become mentally unstable and stuff like that. So for them trying to ensure that the young people are okay, they are ensuring that they are part of the agenda of ensuring that the young people have access. We were seeing mothers are bringing their girls to get to test for HIV, others are bringing their girls to access family planning. So yeah, we've seen like the impact is being seen.
All right, Natasha, thank you so much. Your project is really doing well. Kudos to you. I'd like to turn to you, Ziambo. I know you've been quiet for some time.
Yes, sure.
What are some of the challenges? Natasha did mention about young people are coming to the weekend clinics. After the weekend clinics, maybe they're interested in accessing PrEP. Then they are linked to a healthcare provider. Now, you are the healthcare provider, for example, that they are linked to. What are some of the challenges or barriers that young people, are put in your context in Chipata, might face when trying to access PrEP? And what is Kapata doing, Kapata Clinic doing about it to overcome these challenges? And as an addition to that question, could you share any success story, for example, of how PrEP has made a positive difference in the life of a young person that you have worked with while maintaining their confidentiality?
Right. Okay.
It's a
Thank you so
mouthful,
much,
I know.
Mr. George.
Yes,
Yes.
yes.
Sure, sure. So on the challenges, I think one of the huge challenges I've noticed where I'm working from, I think is lack of information. Uh, and many of these young youths, they've heard about PrEP, about PEP, but they don't really know like how effective it is and when should you take, stuff like that. So one of those challenges, like I mentioned, is lack of information. So as Kapata, what we're doing for us to help out with this challenge is we're working with other stakeholders so that we can disseminate this information to these young or rather adolescents. So I would say TYP is one of those stakeholders that we're working with. We're also working with Zago, specifically in spreading this information about PrEP. And I also say for the young people who are also watching, it is also important for them to be part of a friendly space. A friendly space at any clinic, if at all they are in whichever area they are. It's better they are connected to any friendly space, because that's where we usually discuss this information about PrEP, about PEP. So I would urge youths, adolescents, also to be part of this facility space, so that they can get this information. But we are also doing the most also by going into the field, even as we go, like Natasha mentioned, to say, during our weekend clinics. This is also, we take this as an opportunity also to explain to them what PrEP is, what PEP is, because most of the time we might find we are not even with the commodities, but looking at the audience that we're having, as we are conducting these clinics, it is also important to lay down the information to say they should also know about PrEP. And for the successive
All right.
story,
Thank you.
Yes, so for the successive story, I would say, I think I had one adolescent I came across as I was working. through my office, which is the consultation office. This adolescent came through. I think he came, if it's not twice, it's 3 times. So each time he comes, he was having STIs. Each time he comes, he was having STIs. So I engaged him. I had a talk with him, and like she mentioned, is it? I've forgotten the name. The presenter. Most of these, yes, most of these adolescents, you might find they are not even adhering to like using protection. So I had to cancel that adolescent, and I also introduced the issue of PrEP to that individual. And he knew about it, but he didn't have much information about PrEP. So I had to explain to him how it works and when you should take it and how it can protect you. And eventually he accepted and he got the drug. And by that time, we didn't even have the injectable ones. We only had the tablet ones. So he started. Of course, we took him through the process. He started. And in the end, because I counseled him even on the use of condom, in the end, he came to me and appreciated, say, it's good that I even met you, because I was also scared of how my sexual behavior was. But after you introduced me to PEP, to PrEP, I think I'm now okay, and I'm able to adhere to taking these drugs.
Wow, that's a powerful story. I'll tell you what. I'm sure he knows that you are talking about him, so he'll probably come for you. So, Monida, I'd like to move to you, talking about PEP. Ziambo, thank you for giving us that story on PrEP. Now, Monida, I'd like you to give us a bit of information with regards to PEP. In your experience, what are some of the practical challenges that young people face in Choma when it comes to access of PEP, and how is Choma General Hospital working to make sure that it is accessible and youth-friendly? In that same vein, from your perspective, what are some of the crucial messages about PEP that you want every young person listening right now to understand? So you can combine your response.
Wow. Okay, those are very interesting topics. So with regards to PEP, the young ones, mostly like my co-presenters have said, it's the issue of information. So when it comes to adolescents, the first contact with you as the health care provider is very important. How you receive them, and for them, what you tell them most of the times, of course, when they come to you, they'll come with their other information that they have. But when they come to meet you, they want to add on with what they have with this issue of technology. So how you handle them, the first contact is very important. You might miss them, you might misinform them, you might confuse them. So as the healthcare provider, it's very important that you are knowledgeable about that particular service that this adolescent has come to you for. So when it comes to PEP, when you have an encounter with an adolescent, you need to explain to them, because most of the times when they come to you, they are broken because they know that they've been exposed. They will start crying, they are worried. So it's a duty to give them the right information and make them, you calm them down by counseling them and giving them the correct and practical answers that they will go with. When an adolescent is exposed, like one case I had, you sit them down. Of course, they'll be crying. They'll cry. They'll think as if their lives have ended, like they have this, they've gotten the virus and stuff. But you assure them that this PEP that they're going to have, if they've been come within the required time, like the same days, the days that we said, the 72 hours, if they're within that period, you encourage them that there's this drug here. The service is readily available. The drugs are readily available. counselors are there to deal with these adolescents who are broken. Like we know, adolescents, the way they think is different with the way an adult thinks. But when it comes to HIV things, even adults break down. What more, this young one who is not really fully developed mentally, emotionally, even physically. So they have a lot of issues going on with them. So when it comes to PEP at the hospital, the services are very good. They're very smooth, ready, available. Counseling services are done where they'll make sure this adolescent is cancelled properly. When the adolescent is cancelled, they take them to the next stage, like I explained earlier, where the dispensation, they test them and then dispensation of drugs is done. So really at the hospital, I would say the challenges when it comes to PEP dispensation is not really a challenge because the drugs are readily available. People who have been trained to handle those cases are always there to receive these young ones, assure them, and believe me, you confidentiality is at top notch. Like there's no way this, I've never heard of such issues where this person receives PEP and the information is leaked to the community. People are trained to be confidential in their services so that this adolescent is not missed. Like, when an adolescent, you have one adolescent who comes to you, if the services are okay, they might even refer the friends to come to your facility to receive that service. But if you receive them with an attitude, believe me, you are going to lose that adolescent and many more who might have want to come and receive those services at your facility. And what was the last question again? Your questions are really long.
Well, my question was what crucial message? I think you did address that. The last question was on what crucial message would you like to share about PEP that every young person should know today?
Okay, so like we know, PEP is post-exposure prophylaxis. So how this happens, like I earlier explained, there are those who are raped, so like these adolescents who are raped. Immediately they come at the facility, you offer them the PEP services. So it shouldn't be, and then for those who are sexually active, it's not a routine like, today I'm going to sleep with this man, and then I'll go to the hospital, get PEP. The next day I'm going to, they will give me this PEP, and then I'll take. Again, food, I'll have another encounter, I'll go and get PEP. So PEP mostly it's for emergencies. So when you have an adolescent who comes and through your counseling, they open up, they tell you that they're sexually active. You bring in now the comprehensive package where you talk about PrEP, because you know that this adolescent is sexually active just from talking to them as a good healthcare provider who has been trained properly, like within counseling services, whereby this adolescent is free to open up and bring out their challenges. You might be able to tell that this adolescent is sexually active. Some they'll even tell you, I've got 2 boyfriends, and you ask them, what number, like, how many times have you come for PEP? Some they'll say this is not the first time. So like that, you'll be able to know that this adolescent is sexually active. You bring in the issue of PEP and other preventive measures that you can share with them so that they don't endanger themselves. There are a lot of STIs that we have around. Of course, we're talking about HIV, but there are other dangerous, other deadly STIs that these adolescents can get. So when they come to your facility for PEP, and if it's not the first time, you bring in now the full package where you even bring in the issue of other preventive measures on family planning. You talk to them. For adolescents, when you have one adolescent who has come for a service, don't take it lightly. Make sure you give them a comprehensive package. Maybe it may be the last time you're seeing them. It all depends with your reception. If your reception was good, they might come. But when you have one adolescent who has come for that service, take it as a rare opportunity and privilege. If they're even willing to listen to you, bring in the comprehensive package whereby you tell them about other measures that they can put in place to prevent other STIs aside from HIV.
All right, thank you so much,
Thank you.
Monida, for that one. That's well spoken. I'd like to come to you, Rennie, as we wrap up the episode on PrEP and PEP. Does PrEP and PEP really work? with your organization, with regards to your organizations, Lad Kings, I know you face a lot of challenges when it comes to delivering PEP services, PrEP and PEP services. I would like just to know, maybe quickly, in not so many words, how do you overcome those challenges? And also, what message do you have for our audience to take away with regards to PrEP and PEP, with its effectiveness and accessibility?
All right. Oh, I'll be very fast. Okay. Number one, how do we overcome how do you overcome challenges? Collaboration. In the reproductive health or SRH programming, collaboration is very key. So collaboration in terms of capacity building, collaboration in terms of service provision, and also referral pathways. So when we don't have systems in place that can ensure that we don't provide services accurately or diligently, we work with partner, organizations. If do they have services that we can that they can offer better, we work with them. And also if they have other systems in place, like maybe hubs, they have other systems in place, like, or they have other services that we're not able to provide in the moment, but we've seen that there's a dire need among young people, we'll be able to refer to other partners or other stakeholders that are able to provide certain services. But also especially now with the influx of HIV prevention, there's a lot of learning that has to be done. There's a lot of capacity building that has to be done. So for us, we spend a lot of time learning, and also just being capacity built in different areas to adapt to the different changes that are coming. And hence we tap into the knowledge of other partners at national level, but also at an international level, learning from organizations like AVAC and also International AIDS Society, who are really keenly working in HIV prevention, has been really working for us. But also, most importantly, doing constant or cyclic quality assessment, quality assurance, to ensure that we are doing the right thing. We see where the loopholes are, where the gaps are, and we address those gaps is really, really, really helpful. And lastly, most importantly, learning from the beneficiaries themselves. This is involvement of young people, because they are the center. They are at the center of these services. They know what works for them. They know what fits them. So getting feedback, constant feedback from them, to see how best can we improve services, how best can we do better, what loophole are existing, and what mitigative measures can we put in place to ensure that we address those loopholes or those gaps or those challenges that are existing. So really, that's what we are doing as an organization, And then the last part, the very key message that I would want to put out there is no shame in taking HIV prevention. There is no shame. I want to talk to young people out there. I know there are a lot of myths and misconception, and there's a lot of stigma that is existing around HIV prevention. But trust me, there's no shame. You're doing the right thing. You are putting your health ahead of you. You're prioritizing your health, and you are ensuring that you are safe. So please access services. Speak to the nearest person, go to the health facilities, ask as many questions as possible. And there's a lot of information out there. Ensure that you get the information from the right person, especially before you get yourself on any HIV prevention method. Go to the health facility, speak to a nurse, speak to a clinician, or speak to a fellow young people whose capacity built in HIV and HIV prevention, so that they are with you as you start your journey, and they are your supporter. They give you checks and balances, and also just help you ensure that you access enough information. So please take that HIV prevention method to help you enhance your life and also prevent you from acquiring HIV. Thank you.
All right, thank you, Rennie. On that note, I'd like to thank our guests for today for making the show possible. My name is George Mukwita. It has been a very, very interesting show. Unfortunately, we gotta love you and leave you until next week at the same time. Thank you for streaming with us once more, and do take care of yourself. Bye-bye.